Hello, I'm Nisreen. I'm one of the doctors in the clinic today. Can I confirm your name and age, please?
I'm Anne Bailey and I'm 56 years old.
Hello, Anne. I believe that you are here today to know more about your biopsy result. Is that right?
Yes.
Okay, I have your result with me now and I will let you know about it. But before that, can I ask you a few questions just to know more about you?
Yeah.
So, can you tell me why did you have this biopsy for the first instance?
Well, I'm on HRT since a long time and I was fine, but I developed some bleeding recently, so I had this biopsy.
Oh, can you tell me more about this bleeding, please?
It's just spotting and it's not regular, and I started having it 3 weeks ago.
Okay. And since how long have you stopped your periods?
Around 3 to 4 years, and since then I'm on HRT.
And you still taking it right now?
Uh, no, I stopped it since I developed my bleeding.
Okay. And are you sexually active?
Yes.
Okay. And are you up to date with your smears?
Yes.
Okay. Do you have any other concerns with HRT treatment?
No, I'm totally fine. This is my first time having any problems with the treatment.
Okay. And how many children do you have?
Two.
And you deliver normally?
Yes.
Okay. So have you ever used any hormonal contraceptions before?
Yes, I've used mini pills for a few years, and then my partner got the snip, so I stopped using contraception.
Okay. And do you have any other like conditions, like any medical problems?
No.
And do you have any previous surgeries at all in your tummy or down below?
No.
Okay. And any family history of concern?
No.
And what about, do you know about your BMI?
Yes, it's around 34.
Okay. And do you smoke?
No.
Do you drink alcohol?
No.
And do you have enough support at home?
Yes.
Okay, that's great. So, coming to your result, actually, the biopsy taken from you and the histology report shows that you have what we call endometrial hyperplasia without atypia.
What does this mean? Does it mean I have cancer?
No, it's not a cancer. It's actually just a simple thickening of the lining of the womb, like more than what we expect. Usually, when we are having some hormones, because the lining of the womb is hormone dependent, sometimes it can grow under the effect of these kind of hormones. And the issue, we have some risk factors here that may be the contributing factors that uh, you develop this condition. um, Main thing is, sometimes we consider the BMI on the higher side can be a risk factor, and also using HRT. So these are actually reversible factors. So if we stop like the HRT, we expect that you may also have a spontaneous regression of the problem, and we may act on also reducing some of your weight, and this will help as well. Coming to your concern, is it a cancer? It's actually not a cancer, but we consider it as, like, a precancerous condition, but it's only less than 5% who can develop a cancer over 20 years. So just to reassure you, some of the patient who has who have endometrial hyperplasia without atypia may have spontaneous regression without any treatment. Um, so do you want me to go ahead with the treatment options?
Yes.
Okay. So actually, since I told you that this lining of the womb can be hormone dependent, so it's the same rationale of treatment is to give you some treatment which contains some hormones, and these hormones can act on the lining of the womb and causing thinning of this layer, and then regression of the disease may happen. So it can be either you can take continuous progesterone tablets without stopping, or to put a Mirena coil um, in your womb. And then this Mirena coil, we can leave it until we have the complete regression of the disease. You may need like a 6 monthly interval follow-up surveillance. You may come every 6 months to have another biopsy taken, and then once we have 2 consecutive negative biopsies, then we can discharge you, and only we may need you to come every 1 year just to repeat the biopsy. So, do you have any concern about that?
Well, can I know what this does and what are the risks of this?
Of Mirena coil?
Yes.
Yeah. So actually, Mirena coil is just a coil which we can insert inside the womb. It can be done even today in the clinic, and it contains some hormones, and it releases very few amount of hormones in your blood, and it acts locally on the lining of the womb, causing gradually thinning of it, and then we will not have any further disease inside the womb. We given you 6 month interval just to give time to the coil to act, so it may be at least 6 months for the coil to act on your lining of the womb, and that's all the benefit. Okay, the possible risk is like, as any coil, it can cause some crampy abdominal pain after the insertion. Sometimes you may have some spotting. It also increases the risk little bit of infection if you have like any infection in your pelvis. It can, like, increase your risk to have it again. And also sometimes it may be a cause of injury to the neck of the womb or injury to the womb itself. But don't worry, sometimes if that happen, we can expect that, and we may need to take the coil out, and sometimes if you bleed, or if we suspect that there is a hole in the womb as a result of the insertion, we may keep you under observation for just 24 hours in the hospital. Okay?
Well, I'm now very anxious about it. Can I have my womb removed instead? I'm postmenopausal, so I don't need it anymore.
Yeah, I understand your concern completely, but we don't really offer like removal of the womb as the first line of treatment. We keep it, if for certain conditions, like if we used the hormonal treatment for at least 12 months, but we don't have any regression of your of your disease, or if your bleeding still persistent during the use of treatment, or at any time when we take your biopsy we found progression of the disease, or sometimes even after completion of your course of treatment, sometimes this condition can come again. So in that situation, yeah, we may consider removal of the womb. Otherwise, we don't offer it as a first line, because the hormonal treatment prove great response for most of the ladies who have this kind of disease. But I just need you to know, if we decided to remove your womb at any point, we may consider removing of the ovaries and the tube as well, because this will prevent you to develop any ovarian cancer or anything later on. And usually we may consider doing it like a keyhole surgery, because that will ensure a short hospital stay and a quick recovery with less pain.
Well, what about the treatment that burns the lining of the womb? Can I have that instead?
Yes, it is endometrial ablation, but unfortunately we are not offering endometrial ablation for cases of endometrial hyperplasia, That's because if we do the ablation, we are really not sure that we removed everything, and sometimes it may cause adhesion inside the cavity of your womb, and this will make it difficult for the follow-up biopsies to be taken. Okay, do you have any other questions?
No.
Okay, so uh, have you made your mind? Shall we go ahead with Marina coil today?
Yes.
Okay, thank you.